Clinical Laboratory Improvement Amendments, or CLIA requirements. CLIA requirements for non-waived test methods quality assurance. Non-waived means that they have to actually be performed by qualified laboratory professionals. CLIA waived means that any healthcare provider with basic training is able to perform it. So there's a lot of like quick tests and bedside tests that can be performed on patient specimens. One of those would be like a quick iron check for iron in the blood, or a quick blood glucose can be detected using the standard monitors bedside. But we're talking about for non-waived test methods. So non-waived tests, these are the ones that actually have to be performed in the clinical lab. Patient test management, so patient preparation, specimen collection, test requisition, test relevance, and necessity. So all of that needs to be documented with protocols and such. Laboratory procedures that are signed by the laboratory director. So when you have standard operating procedures or protocols for performing particular tests, at the bottom they have to be reviewed and signed. You'll usually see like last reviewed by and the name of the laboratory director, and sometimes like a supervisor or lab manager as well. Quality control, proficiency testing, and test method verification. So calibration and verification, personnel, record, and specimen retention. So have to have documentation of how long you keep your specimens after you're done running the tests, communications, and any complaints. For unmodified Food and Drug Administration FDA approved or FDA cleared systems, the laboratory must demonstrate that it can obtain performance specifications comparable to those established by the manufacturer for the following performance characteristics: accuracy, precision, and the reportable range of test result for the test system. Verify that the manufacturer's reference intervals, normal values, are appropriate for the laboratory's patient population. Tests that are developed in-house by the laboratory or modified or not cleared or approved by the FDA, before reporting results for each test system, establish performance specifications for the following: accuracy, precision, analytical sensitivity, analytical specificity to include interfering substances, reportable range of the test results for the test system, reference intervals or normal values, any other performance characteristic required for test performance. If a laboratory performs the same test using different methodologies or instruments, or performs the same test at multiple testing sites, the laboratory must have a system that twice a year evaluates and defines the relationship between the test results using the different methodologies, instruments, or testing sites. So through the next couple lectures here, or lecture videos, we are going to talk a little bit more about methodology, method verification, and how you would take data and compare two different data sets.